Hi, I'm Jean Campbell and welcome to I'm Fine. This episode is proudly sponsored by the Medical Research Foundation. Many of the diseases and conditions that affect us and our loved ones have been overcome through medical research. But millions still suffer from debilitating health challenges. The Medical Research Foundation is committed to finding solutions for a whole range of overlooked and underfunded health challenges, from chronic pain to neglected areas of medical health. Your support can make life-changing medical research happen. Find out how by searching the Medical Research Foundation online. Today, I'm joined by Dr. Lauren Heathcote, a senior lecturer in health and psychology at the Institute of Psychiatry, Psychology and Neuroscience at King's College London. Funded by the Medical Research Foundation, Lauren and her team are developing one of the first behavioural interventions to alleviate the impact of chronic pain in childhood cancer survivors. Lauren, welcome.
Thank
you so much for joining. I'm so happy to be talking to you today. And I had the pleasure of meeting Lauren through the Medical Research Foundation and discovered the incredible work that you're doing.
Yeah, thank you for having me. It's a pleasure to be here.
Of course.
I'm a psychological scientist and a senior lecturer at King's College London. So we have a research group in the health psychology section in Guy's Hospital. I started as a psychology student interested in humans and the way humans think and behave. I remember when I was studying psychology, I came across this brilliant scientist, Chris Eccleston, who was a professor in the psychology of pain. And I remember being really inspired by him and learning about pain and how, pain is essentially an output of the brain designed to tell us there's something wrong with our body and to protect us from danger and damage to the body. And I thought that was just the coolest thing. And I remember thinking at the time, well, this is really relevant for people who've had an experience of cancer. If your brain is trying to tell you there's something wrong with the body, and if doing that makes the pain potentially worse, it makes it louder, it makes it more impactful, then there's a lot of reasons why the brain might do that after an experience of cancer. And there's a lot of reasons why the brain might feel a need to protect the body. But I remember as a scientist starting to sort of dig into the literature and read some papers and seeing that there was no one really talking about the psychology of pain in cancer survivors. So I decided to try and do something about that and to start doing research in that area.
How would you define pain in light of the work that you're doing for survivors of cancer?
So pain, as I say, is essentially an output of the brain that tells us that there's sort of actual tissue damage or potential tissue damage. And importantly, the International Association for the Study of Pain defines pain as both a sensory and emotional experience. And
Wow.
I think that's critical. In our culture, I think of pain as this sort of purely sensory thing, but really at its core of its definition is that it's both a sensory and emotional experience. And chronic pain we define as pain that's lasted for at least 3 months. It's not as well defined as other diseases.
It's quite vague, isn't it?
It's a little vague. Sometimes people say, well, chronic pain is defined both by it being there for 3 months, but also having an impact, on your life. But essentially, it's pain that goes on for a long time.
It's interesting because I suppose with chronic pain, it feels, at least for me, less connected to a sort of acute, tangible kind of pain because it's there for such a long time. Do you think that there's any truth in that? Because I guess in a way, chronic pain is also something that you have to manage, given the length of time that it's going to be there for. Whereas with a sort of an acute, really, really strong pain that is completely unmanageable, it tends to be something that I, at least, would associate with shorter term pain, but it's not necessarily the case.
Yeah. I think one of the reasons why pain is such a fascinating area of research is that it's still a bit of a mystery.
Yeah.
Certainly, acute pain is often defined by some sort of tissue damage, some sort of immediate tissue damage. that leads to that experience of pain. And one of the reasons why chronic pain is defined as 3 months or longer is because, some people will talk about how most injuries that happen to the body, you'll heal and recover in about 3 months. So if the pain lasts longer than that, it's likely not solely due to, the injury, for example. I don't think that's totally true. I think it's more complicated than that.
Yeah.
We talked about this, that pain is a biopsychosocial experience. And
What does biopsychosocial mean for the listeners?
It means that when we experience pain, there are almost always biological elements. So especially for pain, that's often things like tissue damage or damage to the nerves or damage to the inside of the body. There's psychological factors. So the extent to which your body needs protection, what has that pain meant in the past? What does it mean now? And then social factors as well. And that every time we experience pain, whether it's an acute pain or something that's very long lasting, there are always going to be biological, psychological and social elements that contribute to that experience.
I'd love to understand what kind of patterns you see in the cancer survivors that you're working with.
Yeah, I think it's important to remember that this comes from what is largely a medical success story. We've got so much better at early diagnosis of cancer and treatment of cancer. And that's true for adults, certainly. Breast cancer is a wonderful example, how we're so much better now at detecting.
And it's Breast Cancer Awareness Month at the moment.
And so that's been a huge success story. And actually, childhood cancer is an area that we study a lot. That's an even bigger medical success story in many ways. So if you were a child diagnosed with cancer sort of 40 to 50 years ago, you had about an 80% chance of dying from that illness.
Wow.
And now today, a child diagnosed with cancer has over an 80% chance of surviving.
That's incredible.
So it's a huge success story. And so much money has been rightly poured into finding better treatments and sort of earlier diagnosis. But we now have this growing population of people who are living beyond cancer, living beyond these really intense, often toxic treatments.
It's my understanding that more people are getting cancer these days.
Yeah. Both the prevalence of cancer diagnosis is on the rise and the success of our treatments is on the rise.
Yeah.
It is an interesting world, but there's no doubt we have a growing population of people who are getting cancer and then living beyond cancer. And we have a growing population actually of people who are living long term with cancer, advanced cancer. And there's a whole new area of research on that too. But I think one of the challenges is we have this growing population of people who are, often feel so lucky to have survived cancer. And when you finish cancer treatment, it's a real time of celebration. But then you're supposed to go back into your normal life and sort of re-engage with things that you love. And the trouble is a lot of people are living with things that make it hard to do that. And we have more and more evidence that a lot of people now live with chronic pain as a consequence of their cancer experience.
With that chronic pain that you are seeing in survivors of cancer, I'd love to understand if you've found anything that the chronic pain is linked to. What have you found in your research?
Many others before me and continue to look at some of those biological factors that cause chronic pain after cancer. And, there's a lot of things you go through during cancer treatment that can have a long-term impact on the body itself and likely contribute to the experience of chronic persistent pain. So chemotherapy, for example, can have all kinds of negative effects on the body. It can lead to things like chemotherapy-induced neuropathies, where there's damage to the nerves of the body, which leads to neuropathic pain. There are also,
which would be sort of pain in your extremities,
often is pain in extremities, feet and hands, but can actually also be in other parts of the body. There are also impacts of chemotherapy on your bones, also impacts of long-term steroid treatments, which is a common treatment for leukemia, on the bones and on the hips. People often have to have things like double hip replacements.
Oh, wow.
And then there's, of course, things like major surgeries. Of course, that's true for breast cancer, and radiotherapy as well, all of which can have significant effects on the body and likely contribute to the experience of pain, as well as the tumours themselves. Bone cancer is a good example, where the tumour is in the bone itself, and that can lead to the experience of pain long term. But as I mentioned, your pain is a biopsychosocial experience. And with these sort of profound changes to the body, there are also profound changes to our psychology when we have an experience of cancer. And that was the bit that no one was really talking about, that was really understudied and not understood. And that's what sort of motivated me to do research in this area is, well, we know that there are profound shifts in your mental health, your psychology, and those might also contribute to the experience of pain, how loud that pain is, how interfering it is. And that's what we're trying to understand.
Yeah, it's relevant to maybe mention that it is understood that part of the effect of chronic pain comes from the extended period of being in pain. And so to go through the experiences that people who go through cancer treatment go through, the effect that that must have on your mind, the way that you see the world, your beliefs about yourself, your body, the world around you, the safety of the world must be profound.
Yeah, I think that's really on point. The safety of the world, but also the safety of your body. Mm-hmm. It's interesting. So we're doing lots of research on how an experience of illness, so cancer, pain, other kinds of illnesses shape your beliefs, your core beliefs about your body.
When you say a core belief, what does that mean in relation to your body?
So core beliefs are essentially our assumptions about the way things work in the world. And a lot of psychology, for many decades, psychological science has focused on understanding our core beliefs about ourselves. And that's been really revolutionary for developing things like depression treatments, anxiety treatments. But what I think has been missed is we also have core beliefs about all kinds of things in the world, including about our body. And so we have a research program trying to understand, what are all the core beliefs or assumptions that we hold about our body? One of the things we hear a lot is, I feel like my body is broken. I feel like my body doesn't work properly. It's not a good body. Or sometimes even I feel like my body is my enemy. It's turned against me. And others, they've never thought about their body in this way. And sometimes it takes a while to think, well, actually, how do I think about my body? But noticing what your core beliefs are about your body is a really important step.
Is that something that tends to present immediately after treatment? Or would you say that it could be something that you notice appears further into remission?
It can happen both ways. For some people, I think it's quite immediate. They get that diagnosis, and we often talk about, before cancer, you have the privilege of not having to think about your body. And then after you've had that diagnosis that your body is turned against you somehow, suddenly you're forced to think about your body. And for some people, it's an immediate shift. But for others, absolutely, it happens longer term. And I'll always remember talking to a young person who's involved in our research, a patient partner. And I remember her saying, oh, it's not the cancer that makes me think my body is broken. It's the fact that now, years later, I'm still living and dealing with chronic pain.
Oh.
So for her, it was something, she sort of assumed that after finishing treatment, her body would go back to normal. But that realization that, oh, my body is actually different now and it's not springing back to normal, that's really what shaped her beliefs.
Do you find that there is more prevalence in those who experience cancer in childhood or their developmental years? Is chronic pain more prevalent in those survivors, or is it quite balanced between adults and children?
So the prevalence of chronic pain in cancer survivors is higher in adults compared to childhood cancer survivors. So in adults, our best estimates are that about 30 to 40% of people who've had an experience of cancer as an adult will have chronic pain afterwards. In children, we tend to see that about a quarter, about 25% of people who've had an experience of cancer as a child will have chronic pain.
I mean, that is an extraordinary number of people. And given that it's something that is sort of quite untouched as an area, I'd love to talk about the things that you have found as a means of a solution to work through the chronic pain.
Yeah, I mean, thinking about the solution is the best bit. I think there are so many possible solutions and ways to help people who live with long-term pain after cancer, it starts with research. We have to understand more about why people develop pain after cancer, who does, who's at risk. And then we can intervene early, then we can help support them. And, there's wonderful people around the world thinking more about the biology. So how do we make our treatments less toxic so that they're not causing long-term pain afterwards, for example? And that's going to be, I think, a really fundamental piece of the puzzle. For me as a psychological scientist, I'm interested more in what can we do with our psychology that might be helpful. I mentioned how we found time and time again that having an experience of cancer or any other illness or chronic pain can often shift, that belief you have about your body. What I'm interested in and what we're sort of testing now is whether shifting those beliefs could then have a positive impact on the experience of pain and the impact of that pain. But I think we've established now that, the experience of illness shapes those beliefs, but whether those beliefs can then shape the pain itself is a bit of an unknown. We're doing some research now where we're developing an intervention to see if we can help young cancer survivors. So these are people aged 16 to 25 who had an experience of cancer as a young person, to see if we can help them notice what their beliefs about their bodies are, and then help think about what an alternative but equally truthful belief might be. And this has really stemmed from the research as well, is that we've surveyed hundreds and hundreds of people who've had an experience of cancer. And as I say, many people talk about seeing their body as broken or as an enemy. But we've seen some amazing other beliefs come out, like, having gone through this experience made me see how capable my body is.
Well,
how resilient my body is. It's been hit by so many things and it's still going.
Yeah.
It's still supporting me. And so we're trying to see if those beliefs and maybe shifting towards those beliefs might be helpful and lessen the impact of pain over time. And I think what's critical is the way we're doing this is we've created these documentary style films.
Which are beautiful.
And we worked with a wonderful film company who are experts in ethical storytelling. And we're having this message delivered by young people who've been through this experience. And that for me is absolutely critical, especially when we're thinking about our beliefs. I think even if a doctor or a scientist comes along and says, there are other beliefs that could be more helpful, that are also truthful, you might be like, you don't know what it's like.
Yeah, you don't understand.
You don't get it.
What's also so incredible and also very creative, actually, as a means of research into an intervention for this pain that you see in cancer survivors. It humanizes a very medical, which I can imagine could be quite impersonal experience at moments.
Yeah. And it makes me think about what you're doing with this podcast, the power of hearing from someone else who's gone through this experience. Your experience is normalized. And I think often people who have long-term problems after cancer or any other illness, they often feel quite alone. And hearing from someone else, I felt like my body had totally betrayed me. And I was worried about every single ache and pain. Every time I had a headache, I worried it was cancer. Hearing that from someone else, and such a common experience, but people don't talk about it, that's so validating. And that's a really important,
and it takes away the shame, presumably.
Yeah. I think a lot of the reasons you were asking, why is chronic pain so sort of understudied when cancer is so well funded and well studied? I think part of it is because even for people themselves, we've had a lot that they feel like they should just be grateful that they've been
cured.
They're
alive. Yeah.
And now the fact that they have to live with pain is like, well, I'm supposed to just be grateful. But, I've talked to some brilliant young people who said, no, it's a strength to talk about the experiences you're having, to seek healthcare, to seek support. That's actually a strength.
Yeah. Well, I mean, vulnerability isn't just saying, I feel sad about this or I feel insecure about that. Being vulnerable is so powerful as a tool because it's actually addressing the realities in life. It's health, it's a lack of health, it's finances, a lack of finances, it's your relationship, your sex life, all of these different things that actually can feel really exposing and shameful. And I can imagine that seeing these survivors come into a space where actually they can talk about the things that they're dealing with, it no longer carries such a heavy weight on their shoulders, which takes their energy out of right now and the life that they now have.
Yeah, I think that's so right. And that's one of the exciting things about like digital health.
What is digital health?
So digital health is sort of ways that we can deliver treatments, healthcare using digital technology, media, using things like apps on your smartphone, things like that. What you can do is you can actually bring that normalization into someone's life without needing to go to a support group. And support groups are wonderful for many people, but not all the young people we work with want to go to a support group and want to meet other young people who've had cancer. So if we can bring to them these stories of other people who get it and get them, through films and embed that into the interventions.
And you also mentioned to me when you were at Stanford that you were really encouraged to think outside the box, which I think is really evident in the work that you've since done.
Yeah, and this work came from my time at Stanford. So I was a postdoc in the medical school. I was there for 5 years doing research in the pain medicine department. And I came across another inspiring, brilliant scientist, Dr. Elia Crum, and she runs the Mind and Body Lab at Stanford Psychology Department. And I remember thinking, oh gosh, she does the coolest science. And she had done these really cool studies, showing that the way your mind works impacts the physiology of your body. And then she at the time was developing an intervention very similar to what we're doing now for adults who were starting cancer treatment. So there, she was developing these films that for someone who was starting cancer treatment to help shape their beliefs about the cancer journey itself. So helping someone to sort of normalize the belief that cancer is a catastrophe and move towards the idea that, cancer is manageable, for example. And this was work done by a graduate student at the time, Sean Zion, is now published work. And they found some wonderful effects on health-related quality of life in people who saw the intervention versus people who didn't. I just found that so inspiring. And I knew when I started my lab here in London, I wanted to do something similar, but for young people, because I think that that's so critical when you finish cancer treatment, when you're a survivor of cancer, beliefs about your body are something that's impactful on your physical health and your mental health.
I haven't had cancer, but I do have my own experience with the effect that beliefs can have in relation to one's body. The beliefs that you have about your body actually can affect everything that you do. Do you see a similar thing in the work that you're doing? It actually reveals the impact of something like this.
I think you're absolutely right. And that's one of the reasons, like scientifically, why we're interested in these core beliefs, because the idea is that they sort of sit at the top of a hierarchy of beliefs, assumptions, thoughts, ideas, and they shape all of those things, including how we behave, how we use our body. And this is one of the pieces of the intervention, is helping these young people think through, well, when I feel like my body is broken or my body has betrayed me, what does that make you want to do with your body? Probably not push it too hard because it's not going to do well. Probably don't feel very grateful for your body because it's really turned against you. Whereas the young people that we filmed who have managed to find a way to see their body as something, resilient and capable, despite the limitations they have, despite the pain that they have, they want to do different things with their body. And that was the power of film, was we could show that. So we filmed one of our young people teaching dance. So
Amazing.
She was a dancer before, growing up. She can't be a professional dancer now because of the impacts of cancer on her body and cancer treatment. But she can teach dance. She can move her body. She finds joy in it. And so you're right. I think how our beliefs shape our behavior, how we engage with the outside world is one of the most important bits.
Was she someone who struggled with chronic pain after cancer?
Yeah, so I can talk about her experience. And I think, one of the most important things here is like your beliefs aren't everything. There are objective realities that you face as a human, but also as someone with chronic pain, as someone who's had cancer. There are things that you can't do with your body anymore that you could have done maybe if you hadn't had chronic pain or cancer. So I think this work is important to say. That's not to say your objective reality doesn't matter. It really does. But it's just to say that your beliefs matter too. they also have an impact. And I think for her, for this one amazing young woman, she actually had cancer first as a baby.
Wow.
And so now she lives with quite significant long-term medical effects of having had cancer treatment on her sort of small growing body, one of which is pain. And then she had experiences of cancer later on in her young adulthood as well. For her, it's interesting because I remember talking to her, she's talked about how she would see a therapist for sort of mental health stuff, anxiety, things like that. And she found it helpful. But the turning point for her, she found a coach, I think sort of a life coach, to help her think a bit more about her mindsets. When we use that word sort of interchangeably with beliefs. And to feel like how she could empower herself, essentially, to start sort of thinking about, well, what can I do? What are the things that bring me joy? And how am I going to do those things? And again, I think the critical thing is here, that doesn't mean that you just have to feel good all the time. No one feels good all the time. And life after cancer is hard. And there's a lot of things that are going to make us feel rubbish. That are going to mean we can't do much that day. But for her, it's about thinking of, well, when the days, that she's feeling good enough, like what can she do that's going to bring her joy? How can she move her body that's going to reinforce the belief that her body can support her in what she wants to do in life?
She has an experience and she has the wisdom that comes from that experience and the resilience and strength that she's presumably had to get through it in the first place.
And this young woman that we're talking about, she started her own YouTube channel to share her experience because I think you're right. She realized just that actually her story could potentially help others. And she is an inspiration. She's wonderful. Again, that doesn't mean she doesn't have bad days. I'm sure she does. But it's, she's chosen to use her body as well in a way that helps to support other people.
I imagine it's an incredibly defeating journey. Do you see people who've managed to get through the cancer, but then they use their bodies in a way that is damaging to themselves?
I think pain medication has its place. And I certainly wouldn't want to say that using medication, after you've had an experience of cancer is necessarily a bad thing. It has side effects. And so it's always thinking a little bit about, are the side effects worth it? But yes, I think this comes back to why we're interested in those core beliefs. Because if you feel like your body is working against you and it's broken and it's a lost cause, you're less likely to do things to take care of it. If it's broken, then like, why would I try and get stronger again? Why would I try and eat healthy? Because it's just going to turn against me again. So I think that the beliefs are probably tied to some of these negative health behaviors, and we're trying to do some research to see whether that's the case. Again, like when you've had an experience of cancer, you are at risk for different things. You are at risk for secondary cancers, but also long-term effects of your treatments. And there is an increased need to be careful with your body, but also treat it well, give it things that it needs. And so I think being able to do exercise, whatever that looks like for you, if you're in a wheelchair, that might look different than if you can run, but whatever that looks like for you.
But before we do that, an area that I'd love to talk about is how this language that can happen in the medical world between the doctor and patient can affect those beliefs.
Yeah, I think it's so important. We're developing like the films and the intervention as a tool to give to patients. I think that's one, again, piece of that puzzle about how we can help. Another really important piece is thinking about how doctors talk to patients, how healthcare providers talk to patients in a way that ultimately, ideally, will make them aware of their risks, right? You want to know, like, what am I at risk for? What should I be doing to help support my body? But also instills the belief that their body is capable. Their immune system still works. Even after all the things they've been through, they're still able to recover and heal from things that will come along. And I think that message can get lost in favor sometimes of that risk. So one thing, I remember talking with a brilliant breast oncologist, Dr. Lydia Shapiro, when I was at Stanford. And I remember saying to her, what do you say to patients when they finish treatment for breast cancer? And she said, well, I tell them that they're at risk. And if they feel anything strange, if their body feels weird in any way, come back and tell us and we'll check it out. Because cancer can come back in all kinds of different ways. And we had this really insightful conversation about how that comes from a really caring place, from the medical provider. Like, we can help if you know your body, like you tell us that, if there's anything wrong and we can help. But I think from our research, what we're sort of starting to see is sometimes that can have a negative effect, because it leaves someone feeling like they need to monitor their body all the time. And we also know from talking with people who've had cancer that they often don't know their body after cancer treatment. Everything is different. Everything feels strange. And so for some people, that message, you know your body, pay attention to it, can be a really scary one to live with, because everything feels off. So we're doing research now, and we just received some funding from the Wellcome Trust. We want to know sort of, how do doctors talk to patients, and how can they do it in the way that's both sort of biologically and medically helpful, but also psychologically helpful. One thing that we're thinking about is doctors could potentially say, like, here are some symptoms that you might want to tell us about. Pain that wakes you up at night, things like that. Here are some things that, you could wait a couple of days or a week and see how it goes. And then if it's still there and still bothering you, come and tell us, just to give a little bit of space. And we want doctors to provide kind of medical information that shows that these people's bodies are capable of healing. Absolutely. They can move their body. They can use their body in how they want to.
If you're to sort of pick out the key areas of mindset that are most impactful in cancer recovery and the chronic pain afterwards, what are those key areas of mindset? I'd love to hear about those.
The first few films are about noticing your mindsets, normalizing the ones like, after cancer, I felt like my body had turned against me. I felt like my body was broken. And then helping young people to think about, actually, what is my belief about my body? So noticing,
because presumably a lot of people ignore it or shut it down.
Yeah. And for some people, they just never really thought about it in this way. They've never really thought, And then when you ask them, they go, I guess I did feel like my body was broken. So just taking that first step is important. And the normalization is really important, hearing from other young people, so that you feel like you're not alone in that belief. And then it's about offering alternative beliefs that are equally truthful, but may have a more positive impact on their lives. So thinking about, well, I could see my body as resilient. So much was thrown at it. I lost all my hair. I couldn't walk for a long time. And then look at where I've come to. Thinking about that journey they've been on. What are the ways in which your body has shown that it's resilient, capable of healing, recovering, capable of getting stronger again? Thinking those through. And there we take someone through some steps that you can do to help that. So keep doing the things you love to do. That will give you evidence that your body is capable in supporting the life that you want to live. Try new things. See if you can push your body to its limits a little. Find out the edges of your body's limits.
Yes. And that must take real courage to get to that place of, actually, I can push my body, and actually it's not broken, and it's not going to break. Yeah.
And it's courageous because there will be limits that you'll reach, but it's about testing those limits. Where is my limit, actually? Maybe I could do this. Another young woman in our films, she's had double hip replacement, and she had leukemia as a young person. And she was talking about how the other day she saw someone abseiling, and she thought, I wonder if I could do that. It's like, well, I've got two strong hips. Maybe I could, I don't know, but I'll ask, and I'll see if that's something I can do. So that's sort of being playful with those limits and testing them.
It's interesting. It makes me think of positive psychology, which was started by Martin Seligman. And it's the science behind flourishing humans. He made this model called the PERMA model. And those are the key aspects of what his science-based research shows is part of being a flourishing human. And one of the points was being in the flow state, which was pushing your body to the limit without breaking. But that doesn't need to be like, okay, I'm going to go really fast on the treadmill right now. It could also be, for jazz musicians, it would be being in the pocket. So it would be practicing and getting to a point where they're in this flow state. And what happens or what he reports, is that all of these incredible chemicals and hormones that are hugely uplifting for your mind and body are then released. And it's meant to increase your productivity by 500%, which is amazing.
Yeah. And I always find when we talk about this work and I present this work at conferences, there's a really important boundary between feeling like you can do something and find things that are meaningful and use your body in those meaningful ways, and then flipping over into like toxic positivity. And I always try and make that distinction as clear as I can for myself and for others. It's not about thinking positive all the time.
No, because actually, if you stand in the mirror and you feel like shit, excuse my language, and you stand there and say, I'm amazing, it almost reinforces how bad you feel, because you are so far from the I'm amazing part.
Yeah. And part, I think, of the journey is in letting some of those negative feelings come in. That's really important. You don't push it away. If you're feeling sad or rubbish, like let it come in. And then think about ways of thinking that could sort of be helpful. What are the things you do have control over? And that's why I think the belief work is important, because it's not about finding an unrealistic belief. You don't need to see your body as, Superwoman that can do anything, capable of anything. But you can think of, your body being resilient, capable, and that's truthful, and then helps you sort of move forward as well.
Is the power of your mind part of that body thing? I think of my head as being like a separate thing, and then my body as being another separate thing. But actually, the power that your mind can have on your body and the way that they work together.
Yeah, we're going through such a renaissance in science right now. For good reason. René Descartes sort of separated the mind and the body, right? He said that the mind is separate from the body. And that was a great political move, because it meant that psychological science could come. Okay, we should study the mind as a separate thing.
Thank goodness.
Thank goodness.
Yeah.
But the trouble is now we still see them as quite separate, as if the brain exists in a vacuum.
And it doesn't have any impact down here.
Yeah, and culturally, I think we still believe that they're quite separate from each other. But now there's this new kind of wave of science, which is really starting to bring those two things back together. And I am convinced that it's how we're going to make steps forward in understanding things like chronic pain, but really any kind of mental and physical health, which often coexist, is to try and study how these things work as a whole system. And there are just so many exciting innovations in this world right now in sort of psychoneuroimmunology, showing that there are certain immune cells that can cross the blood-brain barrier, and that the brain itself has its own lymphatic and immune system.
Wow.
There are so many systems that allow the brain and the body to interact as one whole. And, what one thing we'll be doing as part of the intervention is, at first we'll be taking some biomarker measures to see how it influences the body, and potentially even taking some bloods in a future study, to look at how our beliefs might shape our immune system.
So interesting. It makes me think of Djokovic, one of the best tennis players in the world. I know that he has a really strong belief system when it comes to the power of the things that he says, things that he believes about himself, and the conversation he engages in relation to his performance and the effect it has on his body.
Yeah, sports players know the mind-body link so well.
So you were saying it's very important to allow those bad moments to come in, and then you respond to that by thinking of an alternative.
I think that sometimes you've just got to let the bad stuff sit. Right?
Yeah.
Sometimes, if you're feeling really low, you should actually just feel low. Let yourself feel low.
Let it pass.
Yeah, let it pass. Let it sit. Feel it. And then maybe when you feel a little bit more confident to do so, you're feeling a little bit less low, a little bit more motivated. Those might be the times to then think about, okay, how can I do something with my body today that shows that it's capable? How can I do something new with my body to see, what it's capable of? That, I think, is going to be probably the most helpful approach. There's a couple of films where we talk about, is it possible to hold on to some of these beliefs, like the belief that my body is capable or resilient, when you face setbacks and challenges? We talk about, in the context of cancer, there's many challenges you face. One is you get a new symptom and you're worried about it and you're worried about what it means.
What would be an example of that?
Some new ache or pain.
Okay.
And you think, oh no.
What is this?
Is my body turning against me again? And we talk a little bit how that can be a trigger for some of those, other kind of mindsets, like my body is broken, my body is working against me. And we talk through how to handle those situations. And often it is about maybe letting it sit for a bit, see if the symptom stays, see if it goes away. And then if it doesn't, making an action plan. I'm going to tell my doctor about it, and I'm not going to sit here and worry for weeks. And that's often what leads to that real emotional impact. Have an action plan. I know who I'm going to tell. I know how I'm going to tell them something. For a young person, that's important because often their parent was the one who would tell the doctor things, who would talk to the doctor. So when you're a young survivor who's transitioning to adulthood, you then have to take that responsibility yourself.
Scary.
I guess it's me. Like, do I have the phone number of my clinic? Those kinds of things can be helpful. And then we have a whole film that talks about pain. Pain is a challenge. It's a setback. It's a reminder that your body's actually not perfect. It's working in ways that, aren't ideal. Is it possible to maintain a mindset even while you're experiencing pain? And we have young survivors talking about how they do that.
Wow. Where can people watch this film? Is it something that we could link in the video?
Yeah. So right now, we're scientists, so we have to see if it works. So we are about to launch a randomized control trial where we will recruit young people aged 16 to 25 years who've had a previous experience of cancer. And then we'll do a trial where we essentially randomize people to watch the films straight away, or to sort of take a break and just do some surveys and then watch the films later. And we're going to recruit just over 100 young people to do this study.
Wow.
And then hopefully in about a year, we'll have data telling us whether or not it works. And this is important for science, right? Is we need to be motivated and create things that we think will be helpful. And then we need to have equipoise and do the science to see if it works. So that's the phase we're at now. So the films are not currently publicly available, but if you are a young person, who has that experience, who fits that category, and you want to help test it for us.
You can comment on the video.
Yeah.
Maybe.
Yeah. Please get in touch. And we would love to hear from you. We'll put some links maybe to how you can contact us. If we show that it does work and it's helpful for people, our goal is that then we can work with cancer clinics and charities, young people's cancer charities, to try and make this available. And that's the wonderful thing about digital health is we have opportunities to then make this available without needing well-trained, heavily resourced clinicians who are already really busy, treating patients who have cancer. And so hopefully we can then roll this out for anyone who needs it.
What is the success rate that you tend to see in overcoming the chronic pain and the symptoms after cancer? Is there a light at the end of the tunnel?
I have no doubt that there's a really big light at the end of the tunnel. We don't know as much about people living beyond cancer, but we know a lot about treatments for chronic pain in general. And I think overall it's a good news story. For many people, engaging in different kinds of treatments, especially sort of interdisciplinary treatments where we think about the medical side and we think about the psychological side, for some people their pain will go away completely. For other people, it won't go away completely. It might get a little bit better. It might get a little bit less loud. For a lot of people, their pain will have less of an impact on their life. And I think for many people, that's such a huge shift. And a lot of the treatments we have for chronic pain are not actually aiming to reduce the pain itself, but to really improve the quality of that person's life and to stop pain from completely taking control.
Which is everything.
Yeah.
Everything. What is the role of lifestyle that you see having an effect on the pain and the quality of someone's life? The role of the relationships they have in their life, the things they do, having passions, having a community of people in their life, doing things to push themselves physically. their emotional world. How does all of that stuff play into the results that people experience?
We have very good evidence that if you're able to get back to doing things you love to do, being with people you love to spend time with, moving your body in ways that's meaningful to you, that will make your life better, whether you have pain or not. For some people, as they just doing those things, just going through that motion, it makes the pain less interfering because you're engaged in these other things that you love. You're with people you love. And for some people, it seems to change the nature of the pain itself as well. But I think, a lot of our chronic pain programs, the medical sort of treatments that we have, so much of our focus is on doing exactly that. Because if you're able to get back to those things, that can have a significant impact on the way that pain is shaping your life and the interference that it has. In our films, we have a wonderful young person talking about how walking her dog is one of the things that shows her body is capable, and she finds deep joy in it. She doesn't have to run a marathon.
There's something that comes up a lot, at least in my life at the moment, is the role of your nervous system. And your nervous system being something that actually has a role in regulating the pain that you feel. Your pain receptors are in your brain. But your nervous system can also be impacted by your mental, emotional world. Is that something that you see coming into play in this arena?
Yeah, this is some of that really exciting kind of mind-body science that I think
it's so interesting
to uncover. The nervous system is central in our experience of pain.
Mm-hmm.
And we have more than enough evidence that our nervous system is involved in the pain that we feel. I think we're just starting to sort of see some of the intricate ways in which that can be the case. One of the areas of research we're really interested in our lab is called interoception. So exteroception is the way that you sense the world around you. It's your vision, it's your touch, and it's your sort of sound, your audition. Interoception is the way that you sense your inner world, the things inside your body, like your heartbeat, the slow wave of your stomach, your breathing, your sense of breathing. Some people would say pain as well is a sort of interoceptive sense. And there's some really cool studies showing that your interoception impacts pain. So, for example, there's a lovely study where if you present something painful, a pain stimulus, on versus off the heartbeat, it's perceived differently.
Oh, wow.
And I think there's all sorts of ways in which our body is sort of interacting, to produce the kind of pain that we experience. And we're really just at the surface of understanding how this sense of interoception might impact the experience of pain.
I can't wait to hear about all the things that you uncover. I'd love to just know a little bit about what your journey was like as a young woman working in medicine.
It's such a great job. I started with an arts background.
Oh, wow.
So for my A-levels, I did philosophy, English literature and music. I never in a million years thought I'd be a scientist. And I wasn't good at science at school. I wasn't very good at chemistry or physics or biology. We didn't offer psychology at my school, so I had no idea that was even a thing. So if you'd have told me, when I was 18, I'd be a scientist, I'd be like, no. It was when I realized that science could help us understand humans, the way humans think, the way humans behave, that got me excited. And I think that there are so many different pathways to becoming a scientist. There's the traditional, you do science at school, you're good at science, and then you go into it. But if you come from different worlds, like the arts world or from languages, you will bring something different that I think will ultimately help you as a scientist and will help the science. And so the fact that I love philosophy, and that was sort of my background, has meant that one of the contributions I've had as a young scientist is in my theory. So we developed a theory of how pain is perceived after an experience of cancer. And a lot of theory building is really philosophy, essentially. So that helped my science in that way. And then with the English language and writing, being able to communicate science is so important. And so if you're a good communicator, you like to write about things, And that can be really helpful as a scientist. And I found in my career so far, being able to communicate well helps you win grants. It helps you write papers in a way that is understandable. It helps you engage with non-scientists to get the science out
Like
there.
me.
Exactly. And I think we talked a little bit about creativity. Sometimes if you come into this world without the kind of clear-cut scientific training, it means you have to think a little bit more creatively. I'm not the best coder in the world. I'm not the best statistician in the world. I work with brilliant people now who do that and make our science good. But I'm creative.
And you did also study psychiatry at Oxford.
I did a PhD in experimental psychology in Oxford. And then I did a 5-year postdoc in pain medicine at Stanford Medical School.
And you've since won awards for your research.
Those awards primarily came from testing that theory in our lab, but people around the world are now testing that theory. So that's had an impact on science, and that was sort of how the awards came about. So again, I think speaks to my slightly different background in philosophy and in language that meant that we could do something to sort of push the boundaries a little bit.
It's so important, this work you're doing, and I'm so grateful to you and anyone who is putting research into the experience of pain and the biopsychosocial aspect. The fact that it is not isolated to physical pain cannot just be isolated to physical. There is generally very few cases where there's physical pain without mental pain and vice versa. And it's a really, really important body of research that you're doing. Are there ways that people can support this kind of work that you're doing?
Yeah. So we spoke a bit at the start about how cancer research is really well funded.
Which is wonderful.
And really important. We need to keep doing that. But pain in cancer survivors is a topic that's much less well funded. And the Medical Research Foundation are one of the funders that have said, okay, we're willing to put time and resources and support research into this, which has been so helpful. So you can support the Medical Research Foundation. They're also a registered charity. So donating to them will support the kind of research that they're doing. So this project is a collaboration with the Royal Marsden Cancer Hospital. And so that's another way, engaging with those kinds of hospitals as another way to support this work.
Incredible. Lauren, I'm so grateful for everything that you have shared. I know that this is going to be a hugely impactful episode. I think it's really important to ask the question, if you were to give some advice to someone who is at the beginning of their journey, whether it's the beginning of their cancer journey, full stop, or maybe they've come into remission and they're experiencing this pain, what would that advice be?
You're not alone. If you're experiencing pain and it's not going away, if you feel like your body has turned against you and you worry about everything, every headache, you're not alone. Our research has shown that that's really common and it's something that's worthy of help and clinical care. And then I think, secondly, there's room to be optimistic because we're doing research on this. People around the world are starting to do more research, and with medical research, will come solutions. So I think hopefully that's a message of hope as well.
So inspiring and hopeful. Thank you so much, Lauren.
Thank you, Jean.